Peace be to you. This is Omar Abdul Malik, physician assistant and health educator. So I'm here at work. I just wanted to show you guys how my kind of modum operandi that I'm trying to enact to protect myself, my family, and my patients and community members as we deal with this COVID challenge. So, yeah, I'm in my street clothes that I wear to work. So when I get to work, I am developing the habit to put on scrubs, which I leave here. I also have a separate pair of shoes that I actually keep at the hospital. Those don't go home, and I've got my PPE, not my PPE, my N95 mask. I'll upload a video how you get fitted for the N95 mask. It's not just a regular mask. You actually have to go through a process of testing for that mask. And I had to cut my beloved beard down so it could form mold around my face, because you can't have any spaces between the creases of the mask in your face, because that way, otherwise bacteria can get in and get through. And then I have what I call the polite mask. This is just basically almost tissue paper, but I use that as I'm walking around the wards. I haven't decided whether or not I'm going to wear my lab coat as I'm doing patient rounds. I've been trying to limit my physical contact with the patients as much as possible. Obviously, there's times when I have to touch the patient if I'm doing a physical exam that needs to be done, or I'm involved in what's called a rapid response or a code. The patient's heart is stopped, and we got to do that stuff you see in the movies, chest compressions and intubation and placing interosseous needles and all that stuff. That requires a lot of touching and kind of intimate contact with the patient. But if I'm doing regular rounds, I might do a cursory check on the patient. If I need to listen to their lungs or their heart or something like that. But I've been trying to not do that as much, just to more as a precaution or protection for the patient, because I don't know what I'm bringing in from the outside. Are the things on my hands? We have a policy of everybody has outside of their room, they have like a soap dispenser that it squirts out this kind of Prel stuff. So you have to scrub in when you go into the patient's room, and then scrub out when you come out of their room. And it's not the type of surgical scrubbing that you do, but at least you're using hand sanitizer. We're trying to deal with this COVID-19 challenge as best we can. We're still learning about the virus, and I think that the virus is still learning about us. That's the nature of things. So we're doing the best we can to deal with these challenges as we can. And I think we're doing a very good job. Under our conditions, it's not easy. I mean, we haven't gotten. I'm here in Washington D.C., and we have not gotten to the point where it's like New York, where they're actually setting up impromptu hospitals in the middle of Central Park. But these are trying times in which we live, so we have to keep a level head. I honestly do believe that we'll get through this with patience and what I like to call intelligent diligence and working together, Lord willing, inshallah. But that's it for now. I think I'm going to do a video on the different types of isolation. So you hear people being quarantined, where they're stuck in a room, or they have to stay in their house, or if they're in the hospital, maybe they keep them in a special room in the hospital. But there's different types of isolation. There's enteric precautions, or if a person has a bacterial infection of the gut in the stool. There's airborne precautions, droplet precautions, contact isolation. So I think I'll do a video on that because I hear a lot of terms that are being used in the media and they're not always explained. So I hope this tells you a bit about what I do during my day. And my shifts are usually 8 to 12 hours. It's a lot of fun being a hospitalist PA. It's very challenging. I have to constantly read, but that's the type of career that I wanted, where I had to challenge myself intellectually. So if you're interested in being a physician assistant, now would be a very good time to embark upon that academic sojourn. If you so desire, if you think you're cut out for it, it requires a lot of hard work. So it's an undergraduate degree, taking the GREs, getting into a competitive PA program, which is highly competitive. It's very competitive. Getting through it, passing your boards, and then getting to work. So we need PAs, and I'm very fortunate because I'm working. I'm not part of these 10 million people that are now unemployed, unfortunately. God help them. But if you are interested, please leave your questions in the comments section, and I'll make myself available to you to the greatest extent of my ability. Okay, I wish you guys the best of success in your positive endeavors. Be safe, guys. Peace. God bless you.